The American College of Cardiology is pleased to present this online education program entitled CardioSmart Heart Forum on Heart Failure. We are very pleased to welcome all of you today. It's now my pleasure to introduce our speaker. Joining us is Martha Gulati, MD, MS, FACC, who is the CardioSmart.org Editor-in-Chief. Her exceptional commitment to and passion for the study of women and cardiac diseases has won her numerous distinctions. In 2011, she received the first Credo Award from the American College of Cardiology, which was given to honor her contributions to improving cardiovascular health care of women patients. Dr. Gulati has published articles in top peer-reviewed publications, and her research has been featured in hundreds of newspapers across the world. She is also the author of the bestseller called Saving Women's Hearts. Gulati received her medical degree from the University of Toronto in Canada. She went on to complete her internship, residency, and cardiology fellowship at the University of Chicago, where she also received a Master of Science. She is a fellow of the American College of Cardiology and the American Heart Association. In her role as CardioSmart.org Editor-in-Chief, Gulati is responsible for the oversight of all CardioSmart.org materials. Dr. Gulati, I'd like to turn it over to you. Welcome to the presentation.
Oh, sorry, I had mute on.
We can hear you just fine.
Hi, everyone. I am Dr. Martha Gulati, and today we're going to be speaking about managing heart failure. This program is sponsored by Novartis Pharmaceuticals, but I have no disclosures or links to Novartis. So today's program, we're going to talk about heart failure, what it is, who gets it, symptoms of heart failure, and what to expect. We're going to talk about your treatment options. We're going to discuss your healthcare team and your doctor's visits and what you might expect there. We're going to give you tips for managing heart failure and also provide you with some resources for support. So let's start about heart failure. First of all, who's at risk for heart failure? People over the age of 65 seem to be at the highest risk for developing heart failure, but in all honesty, it can affect people of all ages. Certainly being overweight or obese puts you at a greater risk of developing heart failure, but again, these things don't have to be present for you to develop heart failure. Having a previous heart attack, having high blood pressure, having congenital heart defects, meaning defects that you might have been born with at birth, and other heart conditions all make you at risk for developing heart failure. Certainly a family history of heart failure makes it more likely that you might have heart failure. If you're African American, you're more likely to develop heart failure in your lifetime. You're also more likely to develop symptoms at a younger age, as well as admitted to the hospital and have bad complications as a result of your heart failure. Women also tend to have more severe symptoms and greater limitations in activity if they develop heart failure. And here are just two patients, one of them who says, I remember thinking to myself, this can't be possible. I'm only 30 years old. Another patient says that at the age of 47, I weighed a whopping 120 pounds, didn't smoke, walked several miles a day. So in her mind, she didn't fit the bill for someone who would have heart disease. Yet both of these patients had heart failure. The fact is, if you have heart failure, you're not alone. Almost 6 million Americans are living with heart failure currently. And every year, we have almost 500,000 new cases. Part of the reason for this is our population is aging. And as I told you, as you get older, you have a greater chance of developing heart failure. So that might be why we're seeing new cases. The other thing, though, is that we're getting better at treating heart disease. Particularly after a heart attack, survival has improved greatly. But as a result, people who are surviving a heart attack often can develop heart failure. Heart failure itself is the leading cause of hospitalization in people of the age of 65 or older. 1 in 3 people with heart failure return to a hospital about a month after leaving the hospital after being diagnosed with heart failure. Roughly half the people who develop heart failure die within 5 years of the diagnosis. So what exactly is heart failure? Your heart is still working, so it hasn't completely failed. It's just a terminology thing. But it isn't really pumping the way it should. And there's two types of heart failure. The heart failure is what we call diastolic heart failure, where your heart can't relax well and can't fill effectively with the blood that's being given to it. Or it's systolic heart failure, where it can't pump the blood to the rest of the body with enough force, where the heart muscle is the systolic function or the squeezing function of the heart is failing. And the picture down below is really looking at a normal heart and comparing it to a dilated heart. When you have heart failure, it's a very serious condition, and it tends to be a lifelong condition. It usually can't be cured, but like diabetes, it can be managed. When someone is in an episode, we say that they're in acute heart failure or in heart failure. But quite honestly, even when you're not in that active episode, we do think you have chronic heart failure, even if you're not symptomatic. Often having heart failure results in frequent hospital visits. So let's just talk a little bit about how your heart pumps. The heart pumps oxygen and nutrient-rich blood to your body with every heartbeat. And you can see from this picture here of the heart, you can see that from the right side of the heart, we get blood back from our veins. It gets pumped forward to the lungs, and it's the lungs that provide the oxygen. So the blood we think of it as blue blood because it doesn't have oxygen. Once it gets oxygen in the lungs, it returns from the lungs back to the heart as red blood because it now has oxygen. When your heart relaxes, it fills with blood, and when it contracts, it pushes the blood forward in one direction to nourish and fuel the body. So how does your heart pump with heart failure? Well, the heart, as I said, it doesn't relax enough to fill with the blood that it is given, and that's if you have diastolic heart failure, or it doesn't squeeze out sufficient blood, and that's systolic heart failure. So you can have, some people might have heart failure where they have a normal ejection fraction or a preserved ejection fraction. On the other hand, those people with systolic heart failure often have a lower ejection fraction. An ejection fraction is how we talk about how well your heart is pumping. It's the total amount of blood that is squeezed out with every heartbeat. And so a normal ejection fraction, this isn't like grades. I know a lot of people think that if it isn't 100%, that it's not normal, but that's not how heart failure or how the heart itself works. The heart only pumps around 60% of the blood given to it. So anywhere between 55 to 70%, we would say your ejection fraction is normal. So don't think of this like grades. On the other hand, once it falls below 50%, we would say it's below normal ejection fraction. And if it's under 35%, this is very low, and this is for us a magic cutoff that we're worried about your heart function even more so than in the other range above. This is the range that we really worry about because this is the point where you start being at risk for dangerous heart rhythms and also something called sudden cardiac death. It's important that you know what your ejection fraction is and keep asking your doctors about that to know that number. But heart failure develops mainly, like I said, as we age or because of other health issues or behaviors that force the heart to work harder. The heart's ability to squeeze and pump grows weaker over time, and the certain diseases that can damage or strain the heart are things like heart disease. Like I told you, with a heart attack, you're at a greater risk of developing heart failure. But high blood pressure, diabetes can also cause greater risk of having heart failure. There's something that is called the broken heart syndrome, also known as a stress-induced cardiomyopathy, that can result in heart failure. There's problems with the heart muscle that can happen, or problems with the heart valves. There's problems with, you can be born with congenital heart disease, things that you're born with at birth. Kidney problems as well can put strain on the heart and cause heart failure. And infections as well can cause heart problems. There's also some treatments for cancer, like some chemotherapy agents that cause heart failure. The most famous of them is adriamycin. Other thyroid conditions, heavy alcohol and drug use have also been linked to damage in the heart muscle. So let's now talk about the signs and symptoms of heart failure. And the fact is, it's not always obvious. It may not be obvious to you, and it may not be obvious to the doctors. And symptoms can actually vary. If you think something's wrong, it's important to speak up. Here's an example of one of our patients. She says, I had trouble catching my breath and assumed I was coming down with bronchitis and pneumonia. And actually, she was in heart failure. And that's sometimes a very clear symptom that heart failure may be occurring. But it's important to rule out other causes as well. Some of the most common signs and symptoms include shortness of breath. Sometimes the shortness of breath will be with simple tasks, like just getting dressed or walking up a flight of stairs, something you could do before. Also, extreme tiredness or fatigue can be a symptom of heart failure. Just a general feeling of weakness. Having swelling in the ankles or the feet. Particularly, we'll hear from people they can't get their shoes on. There seems like there's fluid down there. Having fluid, though, or swelling in the legs or even in the abdomen or in the veins in the neck can be a symptom. Having a rapid or irregular heartbeat. And particularly one thing is a very fast weight gain that is unexplained by what you've been eating. Especially gaining weight quickly over a period of days, swelling or developing a cough, especially one that gets worse at night, could be a red flag that fluid's building up in the body. And if you have those symptoms, that's really when emergency medical attention is needed. Some people also report feeling full more quickly or a lack of an appetite. They may lose a lot of weight, and we call that cardiac cachexia, but that's usually late in the disease. They can also have nausea and vomiting. They can feel a pressure or heaviness in the chest when they're lying flat. Some people even notice a drop in how often they urinate. The other thing to keep in mind is that symptoms tend to get worse as your heart grows weaker. So if there's changes to your heart ejection fraction, sometimes the symptoms will become more pronounced. It's also important for any women who are listening to this that their symptoms might be different. And so it's important to get anything that you feel has changed acutely to make sure someone listens to you and make sure your heart is okay. So talk with your doctor about any changes in how you feel. And keep a notepad handy to track your symptoms. This can be very helpful when you come into the doctor's office. And as one of our patients said, knowing the symptoms is the most critical part to staying alive. So how is heart failure diagnosed and tracked? Well, the first thing is that we need to get a good medical history as well as a physical exam. So this requires you going to the doctor. The doctor will, when they examine you, will listen to your heart and your lungs. They'll weigh you. They'll ask you how you're feeling and ask you about any personal or family medical history, any changes to any drugs or diet, something that might have changed recently. Then they might order some blood tests or some imaging tests or both to assess any damage to your heart and check how well your heart pumps blood. Sometimes we measure something called a BNP, or beta-type natriuretic peptide, and BNP is all you really need to remember. And this sometimes helps us track if you are actively in heart failure, because when the BNP rises, we know that that's associated with heart failure, where you actually are actively in heart failure or where your heart is maybe decompensating. We also might check thyroid tests. We may do an EKG, might do an X-ray, chest X-ray. You might get an echocardiogram, which is an ultrasound of your heart, and you might also require a cardiac MRI. It's also possible that you might be referred for a cardiac catheterization, and you might be sent to an interventional cardiologist who does this procedure, sometimes to look for blockages in your coronary arteries, but also sometimes to measure the pressures in your heart and to see if you are actually in heart failure. It's one tool we use. What should you expect in the long term? In terms of managing your heart failure, the first thing that you have to do is make your health your first priority. That means going to all your doctor appointments. This is so that you can track your heart function, that your doctor can adjust your treatments if needed, and you can talk about how you feel, if you're getting better or if you're getting worse. So it's so important to keep these appointments, both with your doctors, but also anyone else that they set you up with. Sometimes nurse practitioners will see you in between the time you see a doctor, between the doctor visits. Certainly you need to learn how to pace yourself and rest when needed. Sometimes you need to make some lifestyle changes, particularly to your diet and how you exercise, and these are things you can discuss with your doctor. It's also important that you accept what's normal for you. When your heart is compromised, most likely you're going to feel it. And if it can't get better, you really need to know what are the things you can and cannot do. As one of our patients says, heart failure is a chronic disease, but you can live a long and rewarding life, and she's living proof of that. So what are your treatment options? Unfortunately, there's no cure for heart failure, but there are treatments that can help you live a longer and more active life. These include lifestyle changes, ongoing medical care, certain medications, procedures in certain cases, sometimes heart pumps like something called an LVAD or left ventricular assist device. Sometimes in severe cases or as a last resort, some people will need a heart transplant. Your treatment will really depend on your age, your overall health, other medical conditions, and also your personal choices and preferences. Some of the lifestyle changes that we would recommend are adopting in general a healthier way of life. Asking you to eat a heart-healthy diet is one part of our treatment plan, but particularly we have a big focus on having a low-sodium diet. We also would ask you to watch your fluid intake because, again, this can affect you going into heart failure. You may be someone who already exercises, but if you are not getting regular exercise, that is something that we recommend. And finding a safe and reasonable level of physical activity is important. But it's also important to talk with your doctor about what activity do they expect you to do, and even if you might be a candidate for cardiac rehabilitation where they can actually give you a prescription for what activity is safe for you to do at home. Certainly don't overexert yourself if you're just starting out an exercise program. We would also recommend that you lose weight if needed because excess body weight makes it harder for your heart to work, and already if you are in heart failure, you're already putting a lot of strain on the heart as is. In addition, you will be told to avoid alcohol, tobacco, and any stimulants like cocaine, methamphetamines, anabolic steroids. In terms of ongoing medical care, you should expect frequent follow-up visits and tests to assess how your heart is working. The other thing is that when you get medical care, they're going to keep an eye on other cardiovascular risk factors and other conditions such as diabetes or sleep apnea because these can affect your heart failure. We'll ask you about, you will work with your physician to take steps to prevent other illnesses, and everyone with heart failure needs a vaccination for the flu and for pneumococcal disease, so ask if you're a candidate for these when you go to your doctor's visits. Report any changes in your health, particularly quick weight changes or notable swelling that wasn't there before. Make sure you talk about this and see if you might need to come in even if you don't have a scheduled appointment. Ask about a referral to a cardiac rehabilitation program. This can be beneficial to you and is now covered for patients who have heart failure. There's other tools such as telemedicine and CardioMems that has been developed recently that might reduce hospital readmissions, and you may be a candidate for that. Certainly medications are an essential part of treating heart failure. And we know that patients with heart failure take, on average, 11 or more medications. So sometimes it's very hard to keep a track of. Medications are usually used to help your body get rid of extra fluid, or reduce the strain on the heart so it doesn't have to work so hard to pump the blood. We certainly have a CardioSmart Med Reminder app if you like to use your phone to load in your medications, and this can help you remember to take your medications. And you can get this for free on the Apple App Store. When you're taking your medications, make sure you take them as directed by your doctor. And if you don't know how to take them, make sure you talk with your doctor about that. Make sure you read the labels, report any side effects to the medications you're taking, and keep your follow-up appointments because giving a prescription once might require some fine-tuning. You might need different medications or adjustments in your medications. The dosage may change over time. Sometimes you might need more and sometimes you might need less. Tell your doctor if you're having a hard time taking your medications or paying for your medications. This is really important because being compliant with your medications is key to taking care of you and managing heart failure. Some of the drugs that you might be prescribed, one drug is a diuretic, a water or fluid pill, and it helps keep fluid from building up in your body or lungs. Of course, the side effect of these drugs is they make you urinate more frequently, but they're keeping the fluid out of your body. You might have to time when you take your diuretic, depending if you have a car ride to work or if you know you're going into a car. And also same thing in the evening, certainly timing it right in terms of not waking you up at night. ACE inhibitors, or an ACE inhibitor is an angiotensin converting enzyme inhibitor, or another family of the drug is an ARB, an angiotensin receptor blocker. These drugs relax your blood vessels and help lower the blood pressure and reduce the strain on your heart and improve the blood flow. Beta blockers is another drug. It can help slow your heart rate and drop your blood pressure. Aldosterone antagonists help the body get rid of salt and water through urine, and this lowers the volume of blood that the heart must pump. Digoxin is another drug that many patients with heart failure may take. It helps the heart pump better and make it easier for the heart to pump blood forward. Nitrates and hydralazine are often used in patients with heart failure, particularly in African American patients and in those patients who can't take an ACE inhibitor or an ARB. Some procedures may be required for you depending on what your ejection fraction is. And some common procedures are these implantable devices, one of them being a cardiac resynchronization therapy, or CRT. And what it does is it helps coordinate both sides of the heart to pump at the same time, or the way that physiologically your heart was meant to pump if it isn't pumping that way now. Some patients will need an implantable defibrillator, an ICD is the acronym we use for that, and it's a battery-powered device placed under the skin that keeps track of your heart rate. And if an abnormal rhythm occurs and it's detected by the machine, it will send an electrical impulse or a shock to restore the normal rhythm. And these devices often can save your life, particularly if your ejection fraction is low and you're at risk of an arrhythmia. So it's important to know if you are a candidate for an ICD. For patients who have end-stage heart failure, some of the drugs or procedures we do are we use inotropes. Inotropes are drugs that help pump blood more effectively. They help the heart pump blood more effectively. Sometimes patients who are waiting for a transplant might be on these inotropes, but even for patients who aren't a transplant candidate, these might be the difference of being in the hospital all the time, but actually we can send patients home with these inotropes. Left ventricular assist device are devices that are used to help the heart pump better, and again, these may be a transition when we're waiting for a transplant, or even given if you're not a candidate for a transplant. And certainly a heart transplant, for those patients who are eligible and who need it, it's certainly a potential treatment. It's also good to know that there's a lot of therapies being investigated currently in clinical trials related to heart failure. It's an important medical issue, and so there will be new drugs, and there's already new drugs that have been released recently, but other therapies as well, stem cells, gene therapies, and all these novel drugs it may change the course of this treatment and of what people who are living with heart failure actually have to go through over time. Another important part of treatment that must be kept in mind is cardiac rehabilitation. People of all ages and walks of lives are living longer and stronger because of cardiac rehabilitation. And cardiac rehab is a proven way for individuals living with heart disease, particularly heart failure, to regain their strength and improve their cardiac health. A cardiac rehab program is now approved for patients who have heart failure. And it typically consists of 5 components that are nicely shown in this figure. It involves exercise, and you'll have supervised exercise in a cardiac rehabilitation program with the ultimate goal of getting you to be able to be comfortable with moving on your own once you get out of the cardiac rehabilitation program. They also will spend a lot of time, though, talking to you about a heart-healthy diet. And so it's important that it's not just about exercise, but learning this lifestyle. They also work with you to reduce your stress, which is important. They'll talk with you and follow your medical therapy. And the nice thing is when you go to cardiac rehabilitation, they're always asking you about potential side effects. And if there is any problem, they'll probably talk with your doctor as well and keep in close contact with them if there are issues, particularly when the drugs are new. Certainly cardiac rehabilitation helps you stop smoking. So again, if you're a smoker with heart failure, cardiac rehabilitation may help you with that component. Last thing is what your healthcare team and doctor visits, what to expect there. So when you have heart failure, you have many doctors involved in your life. And the first one is your primary care doctor. We need your primary care doctor there because they're going to be the ones that see you more often and monitor your overall and heart health. And they'll coordinate or refer you to a cardiologist if you don't have someone already. The cardiologist, as you know, is a doctor who specializes in the diseases of the heart and blood vessels, and often is the doctor who will be managing your heart failure. So you should have a cardiologist as part of your team. And the cardiologist is a doctor who, as I said, specializes in finding, treating, and preventing diseases of the heart and blood vessels. You may even be lucky to have a heart failure specialist, but a cardiologist will work with your family doctor to help you track and manage your heart failure. Many patients, though, with heart failure may have additional teams of cardiologists, not just their primary cardiologist, not just their heart failure doctor, but also potentially an electrophysiologist, a doctor who specializes in the abnormal heart rhythms, and are the doctors who put in those devices that we talked about, the CRT and the ICD, or the defibrillators, if they're needed. You may also be working with a nurse practitioner, or a physician assistant, depending on the type of clinic you go to. And they all work closely with your cardiologist. They can educate you and your caregiver about your condition and the treatments and the procedures you might need. They can also help you understand the side effects of medications. They can also offer advice on integrating lifestyle changes. And depending on your clinic, they may be the person that you call if there's any issue, and they will relay that to your cardiologist. They may even see you themselves to help decide if there should be changes to your treatment if you're having active symptoms. The other part of your caregiver team is your pharmacist, and your pharmacist can answer questions about your medications. They can review all the medications you have been prescribed or are taking over the counter, and it's important to mention those to your entire healthcare team, anything you take over the counter. They can help you understand your insurance coverage for medications and if there's other options for you. They can educate you about appropriate use of medications, like the times when you should take it, whether you should eat food with your medications. And they can help you in ways to adhere to your medications and to take your medications properly, because this is all key to keeping your heart failure controlled. Another part of your team might be a nutritionist. A dietitian or nutritionist is an expert who will assess your eating habits and offer strategies and tips to adopt and stick to a heart-healthy diet. A dietitian will explain why certain foods raise cholesterol and affect other risk factors, but also they might help you know which ones are high in sodium for patients with heart failure. They also will work with you to come up with some creative recipes and menus and meals that you will enjoy. Just because it says heart healthy doesn't mean it doesn't taste good, so please get that out of your mind. If your insurance doesn't cover a dietitian or a nutritionist visit, there are certainly other resources. And ask your doctor about this, and ask even if your insurance company covers dietitian. Some people just are lucky and have within their health plan that they get free dietitian visits. That's just to everybody in the health plan. So it's important to know what you have with your own health plan. How else can you help your doctor take care of you? I would say the most important thing is preparing yourself for your appointment. First of all, be ready to report. Tell us when you feel your best and when you feel your worst, and if there's certain activities or times of day that you feel less well. Tell your doctor how heart failure is affecting your life. Has it affected your activities, your social networking, your work? Is it affecting your family? Is it affecting your emotional well-being? All of these things are important to discuss with your doctor. Certainly talk with your doctor about other concerns like the side effects of treatment, your diet, your exercise. These are all important to your doctor. And come with questions to ask. And certainly you might have some questions that you already know that you want to ask your doctor, but we've also prepared for you on CardioSmart.org heart failure questions. You can actually look at some of the questions that we think you might need to ask your doctor if you don't know the answer to them. It's a great way to come prepared to your doctor's visit with the questions and be able to ask them, because sometimes when you're in there you forget all the questions you had at home. So if you prepare it in advance, you won't forget, especially if you bring that list with you. What are some tips for managing heart failure? Well, to learn about your specific type of heart failure, know how to recognize the signs of things that might be getting worse. Again, the symptoms might be worsening shortness of breath, swelling like we talked about, gaining weight very quickly, particularly when you gain 5 pounds within 36 to 72 hours. That's something that is very serious and you need to talk with your doctor or potentially come to the emergency room to be evaluated. If you're coughing at night, if you have a heaviness in your chest, or you're not able to sleep flat, or finding you're propping your head on more and more pillows, these might be your specific sign that you're in active heart failure. Your doctor may also tell you, aside from symptoms, that he wants you to keep a log of your blood pressure, your heart rate daily, your daily weight, and if your device, the ICD that we talked about that shocks your heart if needed, if it's going off. So they want to hear from you if any of those, if your ICD fires. It's also important to carry information if you have a device or a stent in place. Keep those things in your wallet with you at all times. Also, keep a list of current medications, the dosage, and who prescribed each of the medications. And I think it can't be said enough that it's important to ask if you need a health alert bracelet. If you think you do, you probably do. And it's important to get a health alert bracelet with some of your information on the back, because that's something you'll wear all the time. And if you can't speak for yourself, someone can look at it and know what your health issues are. Other tips, try to do something good for your heart every day. Exercise, breathe deep, eat lots of fruits and vegetables, watch your fluid intake, stick with your treatment plan, stay positive. Know that there's things we can do to help you with your heart failure management. There's so many advances being made every day. Patients are living better and longer because of the advances in treatment. Pay close attention to your symptoms and don't delay in getting care. And consider joining a support group, because certainly that can help you live with your disease, but also get helpful tips from people who are living with the disease, who may have lived with it longer. Involve your caregivers and get support, because this is really important. Sometimes managing heart failure can be overwhelming, particularly if you're one of the patients who is on 11 or more medications, or if you have a lot of symptoms. Certainly it can be overwhelming. Caregivers can help you manage your medications. They can go to your doctor's visits and ask questions there if you don't feel like you can ask questions. They can help you monitor your progress. They can support you in making healthy changes in your life. They can help you weigh different treatment options if you want someone else's opinion. Certainly, your caregiver can help lift your spirits when you feel down. And also, they keep you connected to the things you love. Another important thing is to plan ahead. Make sure I think every patient needs to have this discussion, no matter what we have wrong with ourselves or if we have nothing wrong. We need to have a living will. Make sure you have a current living will. And also a healthcare proxy in place in case you can't speak for yourself, that there's somebody else that can. Make sure your loved ones know your wishes for your end-of-life care when that time comes. Certainly, this is one of our patients with heart failure. You have to be your own advocate. I look at my beautiful daughter's face and was determined to make sure she had her mother growing up. She needed me, and I needed to be there for her. Now, if you're the caregiver on this call, you also are a very important part of the care team. And there's some tips we have for you to help manage the details and stay organized. Certainly come to your loved one's appointments if you can and educate yourself about your loved one's condition. Go to the medical appointments when you can and take notes. Keep track of test results. And make sure you know what medications are being taken and why. These medications should be reviewed at every visit. And it's important that you know if every medication on the list still needs to continue. Other things, it may sound selfish, but the best thing you can do for your loved one is take care of you. This is a tip for a caregiver. Often they get so focused on the person who's living with the disease that they forget about taking care of themselves. So make sure you put you and your health first. Find ways to recharge. Welcome distractions every now and then. Don't forget yourself to have a balanced and healthy diet. Make sure you are getting enough sleep. Set some limits. There's some things you're going to have to say no to, and maybe you involve other people in your family to help you take care of your loved one. Certainly widen your circle of support. This isn't something that you always can do alone. You might need help from others. And that's another thing, is make sure you accept help from others and ask others to help out, assign some tasks to other people in the family. And cut yourself some slack. This is really hard to take care of someone else. And you need to know that it's difficult and that you are not alone in this. We have other resources for support and information, and probably the best site out there is our CardioSmart.org website, www.cardiosmart.org. It's right here on our page. It's an ongoing patient education and empowerment initiative offered by the American College of Cardiology. Our mission at CardioSmart is to help individuals prevent, treat, and manage cardiovascular disease. And this is where the information, it's not for doctors, it's for our patients, that you can go on this website and get help for many different diseases, not just heart failure. And there's other resources of support and information. These websites are listed here, mendedhearts.org, heart.org, which is the American Heart Association website, the NHLBI, or the National Heart, Blood, and Lung Institute. Their website has a lot of information and also sometimes will lead you down to trials that might be going on that you might be eligible for. And Women Heart, the National Coalition for Women with Heart Disease, specifically for women living with any type of heart disease, is a great resource of information. So I think that we've been asking you for questions, and Kendra, I guess I give it to you now.
Sure. Thank you so much, Dr. Gulati. And just a reminder, if anyone would like to submit a question, please type it into the bottom left corner of your screen and then click on the send button. Also, if anybody does need this PDF version of this PowerPoint as a reference, you can find it in the links box, which is to the left. It's listed as link number 1. That will also list the links that were listed and give you the access to the resources as well. And
I see one question right now.
Yep, absolutely. And that is, can you talk a little bit more about what a CardioMem is? I hope I pronounced that correctly.
Yeah, the CardioMems is a really new device. really just starting to use it, but there's been studies ongoing about the CardioMems for a number of years, and it's a device that gets implanted into your heart, into the right side of your heart. And what it does is it measures the pressures in the right side of the heart. So these are for people that are living with heart failure. Again, there's different criteria that you have to meet in order to get a CardioMems, but it actually has been proven to reduce hospitalizations because we're able to tell the pressures in the right side of your heart remotely. So meaning we as physicians can know what's going on with your heart before you're actually in advanced heart failure, where you are maybe having all those symptoms where we rush you to the emergency room. So again, it is a new device. Your cardiologist may not even do them at their hospital yet, but I will tell you, I think this is a device that's going to be used more and more. And if you think that you're a candidate for a CardioMems, talk with your cardiologist about it. They'll probably end up sending you to somebody who's a heart failure specialist within cardiology, because they're the folks that tend to be the ones that decide if you're a candidate for this or not. But it certainly might, the prediction is it might revolutionize our treatment and reduce heart failure admissions to the hospital.
All right, thank you so much. Our next question, what is your input for, and my apologies if I mispronounce this, EF % greater than 70?
I don't know what the person means by that. If your ejection, maybe you're saying does it mean if your ejection fraction is above 70%? It's pretty rare for your ejection fraction to be above 70%, but sometimes it can be higher than 70% when you're exercising at high levels. It doesn't mean anything bad. It's what we'd call a hyperdynamic heart. But in general, I will tell you, a normal ejection fraction is around 60%. So again, we're not going for 100%. This isn't an exam. This is your ejection fraction. Normally the heart will pump out about 60% of the blood it's given, and that's how it's a fraction. So it's 60% of what blood is given, it's pumping out with every heartbeat. And that's what we would expect to be normal. When it starts falling, as we said, under 50%, we start talking about heart failure, and then when it's less than 35% is when it's in a more dangerous zone for heart failure.
All right, thank you. And before I move to the next question, we have gotten a lot of inquiries of people that would like to watch this program again and share it. So that's excellent. Thank you, Dr. Gulati. And for those that do want to watch this again, that are joining for the live event, you may actually use the same instructions. It will route you to the archived version. If you have any difficulties, you can just contact us at the tech support email, which is listed in the chat box. And our next question, are the questions for physicians that you mentioned, are they for the cardiologist or the primary care physician?
It depends who's managing your heart failure. But I would say that those questions should be brought to both the primary care physician and to your heart failure team, whether that's a cardiologist or a heart failure specialist. Certainly, I don't know if every primary care physician will feel comfortable answering every one of those questions, but at least bringing them to their attention that these are questions you have, and if they can't answer them, hopefully they can lead you or say, okay, that's something that your cardiologist needs to answer, but it's a good question. And I would really, as a physician, I really like when my patients come with questions. And even if the doctor doesn't have time in the visit, maybe there's a lot going on and they already have so much to do, but they can even take your questions if you're comfortable with that. And now with electronic records that many of us use, we can even later when we're sitting down write some answers to you or call you later, go over the questions and make sure that we have everything answered, or even provide you with resources that might help you, or hand them to their nurse and get their nurse to spend some time with you answering those questions.
All right, thank you. And our next question, how much should I limit my sodium?
Yeah, so for everybody, it's going to be different. And, we talked about two different types of heart failure, too. So, in general, I would just tell you in general, the American diet, we all take in too much sodium, whether we have heart failure or not. You might be told to keep your salt intake or your sodium intake to less than 2 grams a day, but it is individualized, so you really do need to have that answered specifically by your cardiologist that might be specific for you. And the other important thing is to, know how much sodium, though, you are getting, because naturally in food, there's already sodium. So if you eat an apple, even naturally, there is some amount of sodium in that. But when you start adding in things, particularly things that come in cans or wrapped in plastic, I'll tell you the salt in them is very high. That's how we preserve things on shelves. And so it's important to know just how much sodium, and it's really a useful exercise to even spend one day or 1 week, if your food changes a lot, to try to calculate just how much sodium you're getting every day. If you go out to a restaurant, you'll have no idea because they shake salt into everything. So that's also something you'd really need to talk to your doctor about if you eat out a lot, figuring out your sodium intake.
All right, thank you. Our next question, when do you encourage fluid restriction to the diet?
Hello?
Yes, we can hear you. Can you hear us, Dr. Gulati? Do you have us on mute by chance, Dr. Gulati? We can still see your line connected.
Yes, I don't know what happened. I'm so sorry.
That's okay. No problem. We can still hear you. The question was, when do you encourage fluid restriction to diet? I'm not sure if that means a certain time of day or just generally speaking when you need to enforce that.
Well, again, this is, something that has to be fine-tuned for the individual. And if you're somebody who's retaining a lot of fluid, you may be told that you need to be on a fluid restriction diet, and that for some people will be keeping it fluid. Some people it's less than 1 liter a day. Some people it'll be 1.5 liters. Some people are allowed 2 liters a day. It really just depends. But when we talk about fluid restriction, that means any fluid you drink. So whether it's tea, coffee, whether it's soup, whether it's a juice, I mean, everything that you think of, whether it's water, anything you take in is counted as fluid. And again, it has to be tuned for the individual, and it really does. It kind of goes hand in hand with your salt intake. So both of those will have to be individualized for the patient.
Thank you, Dr. Gulati. And our next question, are there any new drugs coming out that might help with heart failure?
Well, there's a lot of drugs in development, so it's really hard to get into all the drugs. I think that, there's a lot of new drugs that are being studied right now that may help manage heart failure better. And that's always what we're looking for because like I said, there are a lot of people are going to the hospital with heart failure. So our drugs are good, but they're not always perfect. And so we're still trying to figure out if there's drugs that might work better or work with the other drugs that we have.
Great. Thank you, Dr. Gulati. And just a reminder, we do have a couple more minutes left for questions. So if you have anything you'd like to get answered, please type it into the chat box. That's the bottom left corner of your screen, and then click on the send button. And Dr. Gulati, while we wait to see if we get any additional questions, do you have any closing thoughts or final comments for the day?
I can't emphasize enough for people living with heart failure how much checking their weight every day matters. And it can be the difference between somebody knowing, we talked about that 5-pound weight gain in 36 to 72 hours, knowing that, because this is what really happens in people with heart failure. They can have the tendency to gain weight. Maybe they just had a bad diet. They had some family event. We're getting close to the Thanksgiving time where food choices change a little bit or what people eat. And sometimes this is, we always say that at that time of year, we see more hospitalizations for heart failure, partially because the diet changes. And just stepping on a scale can be the difference between getting medical therapy that we might be able to call in over the phone, telling a patient to take a little bit more diuretic, versus them coming into the hospital. So it really is a partnership. If we can all work together and our patients can work to get with us, this can help us.
Great. Thank you so much, Dr. Gulati. And I think we'll go ahead and we will wrap up for today. So we'd like to thank you so much for joining us. And with that, we will conclude today's online seminar. A very special thank you to Dr. Gulati and, of course, all of our participants for joining us today. Today's program is copyright 2015 by the American College of Cardiology with all rights reserved. This concludes today's program. Thank you for joining us. You may now disconnect.